Some remnants of it. Okay. Really, really thick, really leathery, kind of like the dura mater in the heart. I mean the brain. Okay. So the outermost layer closest to the outer side of the heart, right there, that's the epicardium. Okay. So if I have a pen, I would have to say what's the lining or the protective layering. Epicardium. Okay. Don't worry, I'll pin them after, so y'all can take and we'll number it, so y'all can take pictures of it. Okay. So, the middle layer is the myocardium, okay? So again, within the heart, remember that we have 4 chambers, 2 atria at the top and 2 ventricles. The atria and ventricles are just a space, okay? They're chambers. You have the innermost lining, which is the endocardium. It's actually the lining of that wall. And then superficial to that is the myocardium, okay? It's the muscle part that's actually going to help contract, okay? So myocardium's in the middle, and then endocardium is the light pink, or gray, or whatever, okay? So whenever you first open up the heart, you need to orient yourself, okay? What I always look for is the left ventricle. That's the thickest, it's the biggest chamber, and it's going to have the thickest myocardium because it needs to send blood throughout the entire body. Okay, so here, let's just ignore this side for a second. Here we open this up, we see 2 ventricles, okay? Look at the endocardium right here, I mean the myocardium right here versus right here. It's almost double on this side than that side. So this has to be my left side, my left ventricle, okay? So, I know sometimes it can be confusing whether you're thinking, okay, is it my left or is it the heart's left? It doesn't matter if the left ventricle, if you're looking at it, if it's on the left or the right, okay? Because when you cut the image in half, it's superimposed, okay? So the left ventricle, if you're looking at it right here, is on the right side, but on here it's on the left side, okay? Does everybody understand that? Don't get confused with that. Just look for the myocardium, okay? So, we know that this is the left side, this is the right side. We'll start at the right atrium because that's where we end up throughout the circulation, so we'll go through the whole pathway. Okay, so this heart was actually cut to look at the left side, but in here, this is our right side, so the right atrium would be here. Okay, this space right here. Okay, so blood's going to flow right atrium through the tricuspid valve, which is right here. Okay. Valves prevent backflow. Okay, they're anchored to the walls of the heart by these strings, which are called the chordae tendineae. Okay, so that the valve won't flap up and down. Okay, the chordae tendineae originate. Sorry, I escorted you. The chordae tendineae originate in a muscle called the papillary muscle, which is right there. Okay, so from the right atrium through the tricuspid valve to the right ventricle, okay? From there, and always, again, reason why the myocardium is thinner on this side, we're only going to the lungs, okay? It's not a big trip. We don't need a lot of force to get where we're going, so that's why it's smaller. So our destination is the lungs, so from here, we move to the right ventricle, and then it's cut at the top. I will ask you from the top because this is how I showed it to you. It's easier to see it this way, but you can cut it from the inside. We have the pulmolunar semilunar valve, pulmonary semilunar valve, excuse me, which is right there. Okay, and then the pulmonary trunk. Okay. So then we go to the lungs, we get oxygenated, and then we come back through the pulmonary veins. I won't ask you to identify those because this is a pulmonary vein right here. It kind of looks like the aorta. Usually the aorta has the thickest walls, but right here for some reason they're actually about the same width. Okay, so no pulmonary veins. Okay, so from the lungs we come back through the pulmonary veins and we end up in the left atria, which is the space right here. Okay. We move from the left atria to the left ventricle through the bicuspid valve. And it's actually cut in half. But it's that flap right there. Okay? Again, we also have the chordae tendineae, which are these strings, and then the papillary muscle up there. Okay? So, from the left ventricle, we move through the aortic semilunar valve, which is right here. Okay? And then we go through the aorta. Okay, so if I do ask you the aorta, I won't ask it from here, because you could confuse it with a pulmonary vein. I'll ask you from the opening right here. There'll be like a pin with an arrow, and I'll say name that opening, so that you can orient yourself and say, okay, this is left ventricle, we go from here through the aorta. Okay, so but it'll be that opening. Okay, so once we go through the aorta, we go out through the body, give off oxygen, come back. Depending on what type of circulation, if it's above the heart, we come back through the superior vena cava. If it's below the heart, we come back inferior vena cava. On the back of the heart, you have what looks like a diagonal. Okay, the top right part is the superior vena cava. Bottom left is inferior. Okay, and if you stick your fingers, they actually merge and meet in the middle. Okay, so they drain into the same place. So from there, we end up back to where we started. Sorry. Into that right atria. Okay? Does anybody have any questions? I'll go through it again and I'll pin it, and I'll show you how I would pin it for the exam, and you can